Hey folks, how are you? What do you mean, hold on? Oh, you're really? Oh, but everyone knows me.
You still have to follow protocol. But, okay, so thank you all for coming tonight. And thank you to Bob and Sarah for hosting this evening. And we're looking forward to Bob and his new book that'll be coming out soon. And I think everybody knows Bob very well. So we're excited. We met you all, what, 3, 4, 5 years ago now?
Going into our fourth year.
We're in our fourth
Yeah.
year now, so we've known them for 4 years.
Yeah.
It's been a wonderful time to get to know them, and we're very happy that we've been able to help him pre-launch his book.
Correct. Thank you.
Take it away.
Awesome. Thanks, Doug. Hey, folks. So before I get into any details on the book and all, let me just give you a roadmap of what to expect because we're not going to be here for 2 hours. We are staying according to schedule. I put out a schedule. So the first 20 minutes would be networking, which we've done. Don't forget, there's more food and beverage, etc. Then there's going to be for the next 10 minutes a little bit of an introduction of the book, me, etc. I'm going to read a draft of my intro. Unfortunately for the camera, you're going to see me reading. And then I'm just going to give you a couple of snippets of a little bit of me as an ER physician. John, you're anesthesiologist. You kind of understand this, but most of the others don't understand what's it like to think like an ER physician, and I incorporate some of that in my book. And then lastly, just opening up for questions, remarks, feedback on the book, and I can give you a little bit of insights of what it's like to be a book author and going through what's known as hybrid publishing, and I can explain that in a few minutes. Okay. On that note, let's start. So the first part, a little bit about me. So you guys already know, and Doug did the introduction. But first, before I forget, thanks to Doug, thanks to Nancy, thanks to Smith and Associates. Thank you for all of you to coming to just help support this pre-launch event. My background, I'm an ER physician for about 10, 15 years. A long time ago, I went to medical school in the early 90s, finished training in the mid 90s, and then I practiced until mid 2000s, went to Notre Dame, go Irish. Unfortunately, we finished second this year, but that's okay. Second is better than not in the top 25. And then after that, I spent about 10 years in industry, pharmaceutical work. So a company called Hospira that got bought up by Pfizer. I was a GE Healthcare. I was actually the chief medical officer for one of their divisions. Only 10,000 products, $3 billion business. So I got to see a whole bunch of devices as well. And then I also worked at Abbott Labs in their molecular diagnostics business. So for tuberculosis tests, HIV viral loads, cytomegalovirus or CMV viral detections, and everything else in between for cancers. I saw all of that type of stuff. And then I transitioned out from industry, taking that knowledge to become a consultant. Being a consultant, I actually had the chance to work in several startups, and I wore a startup hat, a CEO for a company, and it's actually part of the basis of the book. Just a little teaser. So if you see the logo, the M, that represents manuscripts.com. So Manuscripts is the publisher, the hybrid publisher that I use. The gentleman that started, his name is Eric Custer. He's out from Georgetown, faculty there, but he's an entrepreneur, book author, and he's done this for hundreds, if not thousands, of authors. And when I sat down with him on this, I was going through a couple of vignettes. The original one was, and Maria, where's Maria? Maria. When I was talking about this 2-3 years ago, it was more of a self-help guide for small business owners. No, my core is healthcare entrepreneurship, stories. And I was when I left when I left the industry and I started my consulting practice, I started with a company based out of Bradenton, Sarasota, and hired to be their chief science officer, immediately became their chief executive officer when the person that they had pegged to be their chief executive officer was too old, didn't know the industry, and was incredible. So I got thrust into now trying to pitch for capital. So part of the story that as it goes is that we're preparing a pitch deck to go and raise funds to a bunch of angel investors, and angel investors are typically small individuals that have accumulated some wealth, not institutional like venture capital and things along those lines, but they're interested in making investments in early stage products. We worked on for months on this, the pro forma, the budgets, the projected financials, the explanation of the technology, what's the ask, how much we want to, what do we need the money for. We thought it was all perfect. I go and give this presentation, type presentation, and then I walk out and we mingle shortly thereafter. And everyone that I'm talking to that are angels were looking at, basically responding to me like I had two heads. Everything was wrong about the message. The ask was wrong because we're looking for $4 to $5 million for a technology, a device that has never been proven before. We don't have any customers, right? So it's early stage, and angels don't invest at $4 million. They make $100,000 investments, $500,000 investments, maybe $1 million investments, right? But they like to have some type of proof of concept. So I didn't have proof of concept. I have this beautiful financial projections, and one of the people that's out from South Florida, one of the South Florida angel funds, goes to me and says, "Bob," he says, "those numbers, they're just a mirage, right? You just put them together and it's a guess." Right. So then as I was sitting with Eric and I told him the story, and says, my story wasn't believable. Right. And that was the aha moment. And then ultimately, as COVID came through, we unwound. And I started realizing like the story is what matters to be able to be credible in the healthcare space. So with this, the basis of the book is it's a guide for those that are aspiring to be entrepreneurs, specifically in the healthcare space, to understand how do you craft messages that are meaningful and memorable to the different stakeholders that you have. And in healthcare, different to say, eyeglasses. Who has Warby Parker? Warby Parker, you've done right. They're a startup success. For 10 years they weren't around. Now they're all over the place. They've done a retail thing. They don't have to go get FDA clearance. They don't have to go and get cleared by CMS to get a billing code. They're just a direct retail player, right? They just come up with an idea, come up with a business model, and off they go. They have certain stakeholders that they have to cater to. Healthcare is a little different. You have doctors, patients, nurses, value assessment committees, insurance providers, right? So the hospital administrators, and then you got others, the FDA. So all of these are different stakeholders, and you need to be able to craft your stories, believable stories, by being able to learn how to do the research to identify what do they want, and then making sure that you get that information to be able to put it into your book. So that's or into your story, and that's the premise of this book. And I'll add one anecdote. It's actually in the intro. I'm currently part of two startups. One just secured a €6.5 million raise. They're an Irish startup. I think these guys are going to be a home run. It's a phenomenal fit. I'm a little biased, full disclosure, but they have a novel surgical retractor for C-sections. So what we're having a problem with is women, the body mass index or obesity is starting to go up. So as the body mass index goes up, the amount of flabby tissue that we call pannus becomes more problematic. We actually had it designed so that you can keep the wound, the aperture open, but keep the tissue deflected away. Nothing else has it. And these guys have won international business plan competitions in the United States and Ireland and in Europe as well. So that one, I've been with them for about 4 years. The other one is a company called Native Cardio based in Naples. and they went through the Texas Medical Center incubator, TMCX incubator. It's a highly regarded incubator sponsored by J&J, and this was 5 years ago. There was a dozen of them in it to get in hard. Native Cardio is the only one left. So you got a dozen very, very promising startups that all went through this very rigorous, well-regarded incubator, and they all fizzled. It says, why are the startup probabilities so bad in healthcare? And that's the other element of this book, is why I wrote it, is can I help people that are forging a path in healthcare? Can they be more successful? So that's the intro. So on that note, let me indulge you with a reading of my draft intro, and you can hold off on comments until we go through the Q&A. If there's a few things that are too edgy, just let me know, because I did put in a couple things that are edgy. And some of these things that I just said will resonate, because you're going to hear them again. So like this. In 2017, I became CEO of MetaPraise, company from Bradenton, a health technology company with a wearable sensor that could help reduce the risk of musculoskeletal injuries for workers in different industries. We crafted a pitch deck presentation for months, rehearsed it in preparation for meetings with angel investors. I thought my first presentation went well, since I covered all the key points in the slides. After mingling with the investors, I discovered I was wrong. What I thought was a rock solid case wasn't. The innovation was unproven, the financial projections were educated guesses, and the business model was fuzzy at best. Most importantly, the investment amount we sought was too much for angel investors. I didn't expect my first presentation to end this way. There are countless stories of successful entrepreneurs, from Henry Ford in the automobile industry, i.e. Ford Motor Company, Thomas Edison in the founding of General Electric, to Elon Musk and his transformation of the electric automobile industry, namely Tesla, and global wireless internet communication, Starlink. These are all noteworthy examples of entrepreneurial success highlighted through MBA courses and evangelized in the media by the likes of CNBC and the Wall Street Journal. However, successful startups are the exception rather than the rule, especially in healthcare. This was brought home for me in the summer of 2024 during a board meeting for Native Cardio Inc., a medical device company I have been working with. Dr. Joseph Pergolesi, good personal friend of mine, he's the company's founder, mentioned that out of 11 startups, the TMCX accelerator in 2021, only ours remained afloat. And the TMCX program is one of the largest in the United States, and one of the foremost for medical innovation. The experience of my first presentation for MetaPraise, combined with Dr. Pergolesi's comment, spurred me to write this book. Or put it another way, why do promising startups fail? Is it flawed science? Is it their team? Or is it something else? As far as early stage medical startups, according to Dr. April Zambelli Weiner, another person I know, 75% of them will fail. Dr. Zambelli Weiner holds a PhD from Johns Hopkins in epidemiology and is a member of the Public Policy Committee for Healthcare Information and Management Systems Society, also known as HIMSS, with a mission to help transform healthcare ecosystem. She has had a front row seat in the arena of medical innovation. But as I learned, success or failure in entrepreneurship starts with a story. The book takes aim at one of the biggest weaknesses startups faces, the ability to make their story believable. Innovators often rely too much on scientific merit and neglect building a story that stakeholders, including investors, future partners, regulators, users, such as physicians and nurses, and consumers, us patients, can get behind. And each of those groups determine in their own way whether your solution is adopted or not. For example, in the digital healthcare space, the Zeo patch, raised $300 million to develop a digital sleep coach device and app, but failed to get it off the ground. One reason for their failure is that they applied a tech-oriented startup approach, not catered to the healthcare sector. And if this trend isn't fixed, it's going to get worse. Learning how to craft your startup's vision into a believable story will put you on a path to success. In addition to helping with funding, a believable story can help you solicit talent to join you, as well as clear regulatory authorities such as the FDA. Because medical startups require so much human and financial capital, it's worth it, literally, to get this right. My motivation for writing this book is to help you, whether you're an entrepreneur in healthcare or not, change the lackluster odds of success that startups have. So you're more likely to get your innovation into the hands of customers, clients, or patients. But who am I? After spending 10 years as a practicing emergency physician in level 1 trauma centers like Henry Ford Hospital in Detroit, I decided to put my Notre Dame MBA to work along with my medical knowledge. After working for Fortune 500 companies, including GE Healthcare, Abbott Labs, Hospira, and Walgreens, I parlayed my medical skills and my previous medical leadership experience in pharmaceuticals, medical device, in vitro diagnostics, and consumer health into becoming a medical consultant. Since then, I have worked with dozens of startups, both as an advisor, chief medical officer, or chief executive officer. And as you know, in 2017, I experienced my own startup failure, which was the beginning of this intro. But I discovered there is hope. Entrepreneurs and founders of startups are curious, highly motivated, adaptable, decisive, and they're smart. As far as direct reasons for startup failures, there are extrinsic variables such as access to capital, economic downturns, the labor market, and others. Entrepreneurs can't control those things. Intrinsic variables such as design, the business case presented to investors, uncovering unmet medical needs, and incorporating the voice of the customer can be controlled by the entrepreneur. A lot of times, entrepreneurs need to adjust their focus outside of themselves. And if you're one of them, this book will teach you how to do that. While my focus is in healthcare and medical technology, what you'll discover here applies to all entrepreneurs, especially if they're seeking investment. The startup journey is a story of stories, each being constructed so they are believable to your target audience, whether that is an investor, a client, a regulatory authority, or other stakeholders within the healthcare ecosystem. So, why are stories important for the entrepreneur? It is because the venture capitalists say they are. Take Michael Berlesheimer, founder and managing partner of B Partners down in San Francisco, who provided this testimonial. I've heard tons of thousands of pitches, and the most common feedback we share is to get the story right. By going to make your story believable journey with me, you will discover how to position your story for the correct audience, how to gather and choose facts that resonate based on that audience, and you will discover the cadence and structure of storytelling that builds on your current business and product knowledge and assumptions. Once you identify knowledge gaps, you can weave and tailor your solution to those gaps and provide the what, why, how, and where around your innovation and startup to help get where you'd like to go. Ready to get started? The end. Thanks for listening in on that. Hopefully it wasn't too monotonous. Look, just time-wise. So when Doug and I talked about this a few weeks back, he was also suggesting a couple of tweaks. He's intrigued by the fact that I'm an ER physician, right? That I've seen the worst. Sarah knows. She back in the days, she knew how bad my shifts were based upon how many times I pulled a martini shaker. If it was two, it's typically average. If it's three, it must have been really bad. So part of the book incorporates some elements on risk. So typically, a lot of startups will focus on the opportunity. I have a device or I have something that I come up with, and then I look at the TAM, the total addressable market. How much money can I make? How big of a bite can I get? And they don't look at the risk that's inherent in getting there. So one of the chapters is about risk, but it takes a story, a personal story of mine to share how I'm wired or how us ER physicians are wired. We look at the worst case scenario first. So when I come into a healthcare startup, I look at what's your risk. Like I look at the technology, does it make sense? But then it says, where are you going to get help? held up or where your hiccup's going to occur. So just this little vignette. So I was working in Detroit. I'm covering our critical care area. It's always busier than shit, and it was a busier than shit day. And there's a girl that comes in, 28-year-old, attempted overdose, or attempted suicide by overdose. Didn't know what pills it were, so it could be anything, right? And then we come to find out that she had an empty bottle of an antidepressant called Elavil, and you don't see it anymore. And there's a good reason why, because it's not the safest of drugs if you overdose. That drug is known to cause a person being able to talk in front of you to all of a sudden being in complete cardiac arrest. That's what happened with that lady. That lady, she's talking to us for 20 minutes. We're doing the workup, we're getting all the labs, and then she's on a patient monitor, and all of a sudden, we spent 30 minutes trying to get her back. And we did get her back, right? But for me, as soon as I knew that she ingested Elavil, she could have easily emptied the bottle down the sink, right? And it was just a gesture. But we don't think that way. We think of what's the worst case scenario, and can we get everything ready to prepare just in case if the oh shit moment occurs. And it did, and we were fortunate enough to be able to bring her back. But for us, we think of risk first and foremost. While if you go to a doctor's office, the doctor's office has a tendency to know you, like a primary care physician. You come into an ER, I don't know you from Adam, except for the frequent flyers. All right, but and there's a lot. Every hospital has a frequent flyer. They're, like Ed was one of them in Detroit. But so we only have one chance to get it right. One chance to build trust, and part of the book talks about trust. Paul Zak is one of the most published researchers in the world, has focused on the hormone oxytocin and trust. Interestingly enough, oxytocin, which is quite frequently used during pregnancy, right, to induce pregnancies and the like, it is actually the central hormone for trust. The more oxytocin you generate, the more trust you will get. It's been proven in multiple encounters, even in geopolitics. If you can go and create trust with your counterparty, you will be able to negotiate. So part and parcel of this is looking at getting back to where I was saying about risk, and then also being able to have credible messages and being able to be trustworthy in front of your stakeholder, because you may be legally oriented, you may be more marketing oriented, you may be FDA oriented. They're all important, because if none of them work, or if one of them doesn't work, you may actually have a failed product. More likely than not, you will. So on that, that's a little bit of the anecdote. Doug has been insisting that I should put that right to the front as the hook. He still says that. I will talk to my editors. I'd be happy to hear your commentary. That's kind of the end of the intro of the book and the like. And a little bit about me as the ER physician. Happy to share any other stories if you guys want to hear other stories of the ER. Sarah's heard them all. She has back when we were dating and we just got married. Every time we went back home, friends of ours would say, "What did you see this week?" Well, tell me the craziest thing that you've seen. Like, there are so many crazy things. I've forgot a lot of them. However, the worst one I've ever seen, the person that liked to mutilate themselves, stuck pins in himself. Hundreds and hundreds and hundreds of pins everywhere in his body. He's a walking pin cushion. Yeah, crazy. Yes, he was crazy. So let me transition into the closing so that we can nibble a little bit some more. So the pre-sale, the book, the book currently sits is that I've written my first draft. It's at about 32,000 words. It's gone through 2 rounds of editing, and then now the heavy lifting comes because I now go through revisions editing. So it's going to be massaging, and it's basically molding clay into a finished product. The book is planning to be released in the fall. Right now, it's slated for late September, early October. The pre-launch activities, and if you see that there's the QR code that goes to my pre-launch page, What I'm looking for is people to join my beta reader community, which is also part of becoming to support crowdfunding my publication efforts. The publication efforts, manuscripts, comes at a cost. I have people that are working on my marketing efforts. They did all the graphics. They've done my video. They've walked me through developing my book. They're going to be going to publish my book, audiobook, hardcover, etc. So I'm looking for crowdfunding support for that. For those that have signed up already, I thank you. Those that haven't and that will, thank you in advance. But just a quick snippet of the hybrid publishing and the purpose of being a beta reader. If you're interested in being part of the learning how to write a book, I can walk you through some of that as well. You can walk through the journey, and I will be sharing my drafts along the way of different chapters that can be. I'm looking for feedback, constructive, some not constructive, and try to make it a better book. I need help finalizing the title. Doug has suggested that the title needs a little bit more bling. I agree. There's also a cover that needs to be selected. All of those things are part and parcel of the beta reader community. And then everyone that signs up to be part of the beta reader community will be recognized not only by getting a personalized copy of the book, signed a signed book and with a signed note card, but their name will actually be included in the acknowledgments of the book as well. And just a word on hybrid publishing compared to traditional publishing. Traditional publishing, you come up with a book, here's your draft, and you hand it over to Penguin. Penguin says, thank you very much. I'll take care of it. I'll put it together, package it up, and here I'll give you a royalty of 5 shekels for every book that you sell, right? But you don't own anything anymore. They control all of it, but it's little cost out for you, but you have no control afterwards. You can do it yourself. You can do self-publishing, go on Amazon. Typically, you're not very successful that way because you have to get word of mouth and you have to get presence. The hybrid publishers actually have presence in bookstores and they can get channels through Amazon and others, but they also give me support up front of what a traditional publisher would be, but it allows me to still own the book. So it's still my intellectual property. So right now, the plan is that there will certainly be an ebook. There's going to be a paperback and most likely an audiobook. And on that note, I'll take any questions and feedback. And thanks for listening, and thanks for coming and supporting me. Thanks, everyone.
Is the thought in the book is broader than just like healthcare entrepreneurs, or is it?
Yeah, yeah. And Doug and I had conversation on this. Doug thinks that I should be just honing it exclusively on healthcare. I think I lean into healthcare, but there are so many things that are lessons within that can be pulled and applied anywhere in healthcare, right? Even if you are working for a corporate entity and you want to go and pitch for some change management idea, the same thing applies. You have stakeholders, you have needs and wants, right? One of the things in the book, one of my chapters is the pitcher and catcher, right? I coined this term. You got to know your audience, so you got to think of the pitcher and catcher. And I start off with a vignette where some reliever just got picked up on a trade. The catcher's never worked with them before, and they get their signals mixed up. And the catcher doesn't know that I'm asking for a curveball and a fastball comes through, and vice versa. If I'm calling for a fastball and a curveball comes in, it's a pass ball, right? And so that's part that I use that metaphor in the book is you need to know your audience, and I use the pitcher and catcher metaphor a lot. I learned it when we were at GE. You got to know who your audience is, and you got to understand what your audience wants, right? So even if you're in a corporate entity and you want to go and change something, same thing applies.
When you look at the structure of the book, like the titles of the chapters, right?
Hmm.
Is there a way of trying to tie the titles of the chapters to the story that you tell in the beginning, so that to me they get to see the connection between what your experience was, and then say, okay, yeah, now I can see how that could apply more to me, right? So initially, I was thinking you were going to say no, it's more healthcare, and I wanted to kind of do that. And I was going to say
Very healthcare oriented. Yeah, no denying, very healthcare oriented. So I'm not. The way the book is written is not specifically addressing ways to be entrepreneurial outside of healthcare. I'm not giving the lessons that are applied in, say, retail, right? But the lessons that are taught within each of the chapters can apply to retail or consumer staples or wherever it may be. Does that make sense?
Who is
And
your audience?
the ideal would be anyone. I'd say there's three. Anyone that's an aspiring entrepreneur in the healthcare space, startups. I work with a lot of startups. Would be one. A great place to target are university biomedical engineer programs that do a lot of early innovation in healthcare. And then the third, and is aspirational for me, is more in the investor community. Being able to go and get angels and maybe I wouldn't say I'm not looking for the billion-dollar VCs. I'm looking for the more boutique VCs, uh, that institutional money, so that they have a better understanding of how to risk stratify a startup.
wouldn't it be good to be bigger, to be big somewhere versus everywhere, right? So
That's what Doug was saying.
uh,
That's what Doug was saying.
So part of what my thinking was, in our age now of the internet, and people have access to so many things, having a product and having it accessible in theory around the globe gives you 9 billion people in theory.
In theory, yeah.
So trying to be something to everybody, there's plenty of people in the three niches that we're talking about. Plenty. And that's my thought on it. But you don't want to miss out on someone is the theory. And sometimes it doesn't quite, you kind of get spread thin, or it doesn't come across as well. Or,
Yeah, the book is not. I don't. The way I've written it, the way and I'm biased. I don't think I'm straddling the pier and the boat too much between entrepreneur in general and healthcare entrepreneur. I'm very much well rooted in healthcare entrepreneurship. Almost everything in this book is really focusing on healthcare entrepreneurship. However, I just leave it there to say there's lessons that can be pulled out that are outside of healthcare, with one exception. Two parts of the book are points of differentiation that I don't think anything in the healthcare entrepreneurship space includes: regulatory strategy and regulatory dialogue. How to deal with the FDA. There are so many startups I've interacted with that are afraid to talk to the FDA. When you're in the device space, those meetings are for free. You only have to wait. You have to wait 60 to 70 days. Right? You got to put a package together, give it to the FDA, and say we want to meet on such and such date in 60, 70 days. It says, okay, no problem. And it says, we want a meeting, or we want just your written response. Here, written response comes back. It's free. And it says, why would you not want to get that information from the people that will be approving your product?
yeah, but again, I think if that's the case, then I would think about honing in on that. So that's where I think that you have there's practical value that you have because you've done kind of multiple different startups and
Mhm.
you've been in on both sides, which I think is great. But I think to me, if I'm looking for something to say to help me, I want to try to hone in on someone that's kind of gone through that. And your component that you said for the FDA, if the FDA is something that's unique or different, and that those are things that are different hurdles, then that would be one where I would think that would appeal to people that would be going through that. And I would say, to your point, there's enough people that are trying to do that.
Yeah.
That I think that the book could still be successful. You could still be successful, but it would be more practical, and I think it won't get lost. I think that's kind of where.
Do you think the introduction was hinting that it is too general?
No, I felt
Okay.
like it was. So to me, I felt like the introduction or the intro was more of a it was healthcare,
Mhm.
more about things that were going to, that have applied in your background and
Yeah.
your experience. But then I feel like the book seems to be a bit more, is broader. It could just be the title I'm reacting to.
Yeah, it could be. Yeah, could be. When I went through the naming of the consideration for the book, I actually asked my editor at that point, my development editor, and he says, "No, keep it broader." Um, that was his, because I asked that because I was wondering, should I tone in on healthcare, and or should I keep it broader to be entrepreneur, right? But this is still Doug opened my eyes, and so I'm open to
The Make Your
massaging
Story
this.
Believable is broad enough that to me it's more about who's the focus for, right? So is it it's a guide for healthcare entrepreneurs. That might,
Hmm.
and that it's still because the story is important, right? And I think
Right.
you can have the greatest solution, but if people don't relate to it, they don't buy it, they
Right.
can't see it.
Yeah, Doug.
We're in sync, because as always, listening to you again, and so the title is Make Your Story Believable. And then I was like, I would like to see the subtitle, Why Do Medical Startups Fail? That's what this
Mm,
is about.
sure,
Or
even better.
a
Yeah.
guide to medical innovators. That's what you're trying to,
Mm-hmm.
yeah,
Mm-hmm.
entrepreneurs, but you really
Mm-hmm.
want to touch the innovators.
Yeah.
And so that then focuses it on the medical side.
Yep.
And I differ with your publisher.
That's okay.
Plenty of
Yeah,
medical side.
that's
Focus
okay. I
there.
yeah, I
And
have
if you
yeah,
success breeds success, write another one that's more general or another area.
yeah.
I like the fact you have fail in the title.
I like that
I
one.
think it's,
Yeah,
it sticks out because it's not
yeah.
something.
I like that one. I like that. Yeah. Why do medical startups fail? Yeah. Yeah. Eric said believable story, that segment for books. He says that's your hook. I mean that because then you can own that segment for books because there's nothing there, which is clearly a goal. But I like that part. The guy for entrepreneurs, you said when we talked 2 weeks ago, it's a little vanilla, right? It's a little safe. Yeah. So why do medical startups fail? Everyone will understand that then, and that's kind of the hook. Yeah, exactly. Great.
So one other quick thing. So
Yeah.
what is oxytocin used to do again?
Oxytocin. Well, yeah, it is. It is. It is literally. It's a hug. The more hugs that you get, the more oxytocin is released.
So the next that you do,
Yeah.
you can put some oxytocin in the water.
You can actually buy it. You can buy oxytocin as a peptide and you can spray it. Yes.
I say the
Yes.
water, you say
Yes.
the water.
You can buy oxytocin as a spray. Yes. Yes. Yeah, but Paul Zak is his name. He's a neuroscience scientist, Minnesota, I think. But he's published so much on oxytocin. Yes. Yeah, so I got a little nerdy on this on story as well. I got into the science of storytelling as well. So there's several people that I reference in this thing. So there's one guy that talks about the angel's cocktail and the devil's cocktail. So there are two different ways to get people to believe or to remember your stories. The angels are a little bit more emotionally uplifting, while the other ones are a little bit more panic and scary driven. Angel's cocktail versus devil's cocktail, just as an FYI. So I got a little nerdy as well. I can't. The MD in me has to shine at some point. Any other comments? I appreciate it. I love it. The title got better.
For the audiobook, will you be reading it?
I will be reading it.
As a book lover and
Yes.
sometimes audio listener, I would highly recommend that.
Yes, I was
Especially
told that.
where these are personal experiences.
Exactly. Yeah.
Somebody else will not be able to convey it.
Right.
I mean, it's more intriguing.
Oh, yeah. Yeah, if I had that budget, right? Yeah.
By now, there's like AI that produces that.
It's just not the same. I mean,
No.
I prefer reading a book, but if you're listening to an audiobook, I 1000% prefer the author reading it.
Yeah, these guys at Manuscript say the exact same thing. I mean, you can get someone to do it for you, but if it's in the
It's like
yeah,
just flat.
if it's in the author's own voice, because they understand it. They lived the book. They wrote it, right?
The passion comes through.
Yeah.
So,
I hope so. I mean, I hope I conveyed a little bit of the passion in the past, 20, 30 minutes as
You have a
well.
good voice. Yeah.
Oh,
Yeah.
thank you. Yeah, actually, I do a fair amount of medical education type stuff. I still do work for GE to evangelize their products. So I've done a series of podcasts and videos for them. Part of it is because they say that my not only my tone but my ability to speak medical terms, I enunciate well. Yeah, yeah. Medical terms aren't that easy for a lot of people.
So you have a
Yeah.
book website available from QR code.
I do.
Do you have any social media?
I do. I have an Instagram page.
What's it called?
Make Your Story Believable.
Really?
Yeah,
Okay, on Instagram.
on Instagram.
So
Yes.
people are on Instagram would like to like the Instagram page and share that.
Thank you. My biggest thing is on LinkedIn because that's where I live. Yeah,
So make your story believable for you, or just you.
it's me and R&B Ventures Consulting, my company. So it's on both.
Is it
So
available through the website? Linkable through the
it
website?
is. Yes. Yeah. It's identifiable through that website. Yes. All my socials are linked there. Yeah. Yeah. He's the social. He pushing me on socials. I've gone off of socials 4 years, 4 years ago, much to Nancy's chagrin. But on that note, thank you everyone. I don't want to take up too much of your time. Oh, Trevor, you had
Yeah, I
your
was
hand
gonna
up.
say two things.
Yeah.
Number one, I think you have your next book already written. Tell me the worst you've seen in ER. Stories.
The needle boy.
Yeah, so that's a chapter right there. No, but two, I was just curious because I feel like everybody has had a point in their life going, this would make a good, I should write a book about this. What took you from, that would be a good idea for a book, to, I'm going to write this book? What happened?
It's a good question. So I got inspired maybe about a year earlier. So I was thinking of writing a book for about 3, 4 years, um, more on how to be a small business owner. That was the thought. When I talked to Eric, he changed that. For me to get to Eric, one of my colleagues at GE Healthcare, her name's Melanie Varon. She worked in the same business or division that I worked in. She was on the commercial side. I saw her publish a book on sales leadership. And so I reached out to her maybe about a year or so ago, maybe a little less than that. And she walked me through her success with working with Eric and manuscripts. So she did the program. It was like a year and a half long program. And she was successful to be able to evangelize her brand, right? The book, a lot of people think of writing books to be able to go and sell the book, as opposed to use the book to evangelize you, to evangelize your brand, right? So she does a lot of consultations, going to different companies, sales roadmaps, etc. Other people have other missions. I'm the same. I can go and do a workshop with me. One of my friends, George H. Right, he's in the book on how to message, right, how to create messages. But one of the other people that's in my book, Donna, who's my work wife, we've collaborated so much for the past 4 years. She's a regulatory specialist. We can come in and do a workshop and do a deep dive on your device or on your technology, identify where your risks are, identify what your regulatory strategy is, identify what kind of clinical studies you'll need, right? We could do things along those lines. That's what I'd like this book to do, to evangelize. But getting back to Melanie, so Melanie introduced me to Eric, and then I set up calls with Eric, and then Eric quickly got me away from that startup success book mindset to tell me more about you, right? And then I started getting onto my entrepreneurship stuff, and it says, man, that story is really good. I mean, this about when it MetaPraise, right? It says your story's not believable. Like you worked for months to get this pitch together, and it was they didn't laugh at it, but they just were completely dismissive at it, and that's where it started from. And they support nonfiction and fiction. So if you're interested in nonfiction, in fiction, that is not me. I am not. I am not a fiction author. Far from it. I can tell you a bunch of stories.
Don't tell me, put it in a book and sell it.
Yeah.
That's right.
Maybe it should be a podcast. Yeah. Yeah. Make a podcast. Yes. Yeah. Cool.
And I'm just curious about whether you stratify the entry level to get into this kind of work. For instance, what did the MBA get you that as a straight MD you would not advise someone to try to become an entrepreneur overnight? And my son worked with venture capitalists
Yeah.
at Costco, which was one pitch line of the group we were targeting,
Okay.
but not as high as Gibson Dunn, which were bigger.
Yeah.
funds,
Sure. Or sequoias. Yeah.
It seems to me that's kind of, is that like a key element here? I mean, you have a good idea, but where do you get the backing to go through the phase 1, 2, 3 trials?
Yeah. What this book doesn't focus on is on pitching, right? On how to get the funding. What it does focus on is how do you go and build proof points, right? Because ultimately, pharma is different. So I include pharma, but then I focus a fair amount on device because device tends to be much more squishy, so to speak.
You mentioned university-based.
Yeah, biomedical engineers, perfect for them. Yeah. Yeah, great place to start. It says what you want to do first and foremost is demonstrate proof of concepts of your technology. So whatever it may be, you want to go show that in a simulator it works, right? Get it to an animal. Does it work in an animal, right? Does it work in a human? The further up the food chain you go, the easier it will be to be able to go and secure the funding from the investor community, because the investor community needs to know, does it work?
Right. But is that like early on the number one
Not
factor?
no, because it depends, right? It depends on the type of device that you want to go and pursue. So the book gets into it, but I'll give you a Reader's Digest version of medical device industry. So you got class 1, class 2, and class 3 medical devices. Class 1, tongue depressors, right? The FDA doesn't really, they care, but they don't care. Class 2 is almost everything in between, but diagnostic tests, anesthesia delivery devices, patient monitors, EKGs, and then you got class 3s that are like invasive, breast implants, hip prostheses, stents that go into the heart. The class 3s, they act much more like pharmaceuticals. Everything is done, you design it, you interact with the FDA, you get it cleared through more of a traditional pharmaceutical development path, much more rigorous. Class 2 is where there's more ambiguity. So class 2, if the device has never been cleared before, so you're creating the newest widget out there, for whatever it may be. If it hasn't been cleared, it will be a de novo path, which means that you need more evidence. If it has been cleared before, you have a predicate. So you basically make a quick copy of it. So you follow the predicate, right? And it says, I'm here, FDA, I am as close to these guys, we call it substantial equivalent, as these guys. If I'm making a predicate, a class 2 device, and I have a predicate, I don't need that much evidence. I'll give you an example. For the C-section, the surgical retractor, there's well-established predicates. We've already talked to the FDA, and we propose to them that we go through what's called the least burdensome approach, which means simply to the FDA, we don't want to go and do human studies in a space that we think would be too burdensome to expose an investigational device to humans. We want to do it in either a simulation environment or an animal study. And the FDA agrees, says, we agree with your approach for least burdensome. We want you to do it in a large animal study. So we'll do the studies in a large animal. But we've already done stuff in, say, cadavers, right? We've done things in non-GLP, non-good laboratory practice studies, demonstrating the proof of concept that it works, that it holds the surgical field open. So it all depends on the device. So it's not a one size fits all. But if you're going after a predicate, right? then your goal is to walk that razor's edge of putting in enough bells and whistles in it to make it different, but not so different that it changes the substantial equivalence argument for matching to the predicate. That's the balancing act. That's the regulatory strategy that most startups get that wrong. They think that they want to be, they claim to be predicate, but then they're asking for the world here, and the FDA says your indication is completely different. Just you're a de novo. They're like, de novo, an extra year or so of clinical research and R&D testing, and then here's the other caveat to that. And sorry if I'm overwhelming you, but it's interesting. If you introduce a novel device, class 2 device in the United States as a de novo, as soon as you get cleared, you know what you are? You're now the predicate. So everyone else can copy you. So then how do you design the device as a de novo to make it so unique that it makes it harder for everyone else to copy you? That's the challenge. That's the strategy. Trademarks are only marks, right? But not that doesn't get you. There's always patents, right? And freedom to operate. But there's a lot of things where there's like 50 of them. EKG, GE came up with 12SL, the EKG interpretation algorithm. But Philips has their own. Mindray has their own, right? Siemens has their own, right? They created their own algorithm, but they claim predicate to the 12SL for GE. And I know that because I oversaw the GE diagnostic cardiology business. The guy that invented that, he's one of the smartest guys I ever interacted with. Humble as humble can be. Yeah, phenomenal. GE people, they're phenomenal. Cool, folks.
Good.
Thanks. Yep. Thanks, everyone. Thank you. Time for a sip. Oh, yeah. There's a Kringle out there.
Get the Kringle.
Yeah, get the Kringle.
The other one is
Thanks for the questions.
oh, that's all right. What you want, so you're trying to help you, right?
Oh, yeah.